Prescription Charges Coalition is calling for the government to launch a review into the prescription charges exemption list in England, which was drawn up more than 50 years ago in 1968. Laura Cockram is Head of Policy and Campaigns at Parkinson's UK and Chair of the Prescription Charge Coalition. Morning, Laura.
Morning, James. How are you doing?
Yeah, I'm very well, thank you. First of all, just give us an idea of how much people with Parkinson's have to pay for their prescriptions.
So Parkinson's is a fairly complex condition, and it's very individual. So some people can be on maybe 2, 3, 4 medications that they would need to pick up a month, but some may be on 9 or 10 because they need certain medications to almost combat the side effects of other medications that they're taking. So clearly a huge amount of money potentially if people are having to pay £9.35 for each individual item.
Yeah, and of course there are some people who are exempt from prescription charges already. If you're over 60, if you're under 16, if you're pregnant, if you're an NHS inpatient, and then also if you're on a range of state benefits as well. But you want the exemption list to be broadened, do you?
Yeah, absolutely. We want the exemption list to be broadened to all people with long-term health conditions. We know that people with long-term health conditions have been struggling to collect their medication for several years, and so we've been calling on the government to review the list for several years. But it's actually, I think, got worse over the last couple of months, and in actual fact, this year, certainly with COVID as well. And you know, earlier this year, the Pharmacists Defence Association completed, of which I think Ade is a member, completed a survey of pharmacists, and they found that 9 in 10 pharmacists in England were saying that their patients were going without medication because they simply couldn't afford the prescription charge. So, you know, we know that this is a big issue, and in actual fact, 68% of those pharmacists said that it had become more frequent within the past year. So we know that it really is having an impact, not just on people with long-term conditions like people with motor neurone disease or cystic fibrosis or Parkinson's or HIV, but actually for the health service as well, because what happens is if people can't get their medication or they're eking out their medication, then they tend to rely on the NHS even more with different GP visits, or even having to go to hospital in terms of accident and emergency. So yeah, we think it's actually not a great kind of. We think it needs to be reviewed urgently, but also at the same time, it's costing the NHS more potentially in treating people than allowing them to stay well.
Well, that's the crucial point, isn't it, about the cost? Because even though, yes, it sounds wonderful, the idea of having, you know, more free prescriptions available, or even if prescriptions were free for everyone, it'd be lovely. But that's going to cost a huge amount of money at a time when, as we all know, the government doesn't really have a huge amount of money. This isn't affordable, is it?
We think it is affordable, partially because, as I said before, if people aren't able to get their prescriptions, they may end up going into hospital, which potentially causes costs more. So, for instance, when we completed a survey a couple of years ago, a lady called Zoe had or lives with polycystic kidney disease, and she was hospitalised twice because she couldn't actually wait until payday to collect her prescription. The first time she went in, she had a lumbar puncture, which costs, over £3,000. And then the second visit, she had an MRI scan, which cost over £130. Now, the cost of, as I say, one item is £9.35. People can get a prepayment certificate, as Ade mentioned earlier on, and that is £108 and 10p for 12 months. But sometimes that's even too much of a stretch, too unaffordable for people who live with long-term conditions. We know that also people with long-term conditions sometimes can't go to work, and so that has an impact on not just their individual earnings but also the economy. So we think it really is potentially an area where the government could see growth, which is obviously what they're talking about. They want the economy to grow.
Laura, thank you. Laura Cockram there, Head of Policy and Campaigns at Parkinson's UK and the Chair of the Prescription Charge Coalition. It says some community pharmacists are considering paying for patients' prescriptions themselves because they're worried the rising cost of living is stopping people picking up vital medication.